Hello students. So we were discussing the ward management and admission discharge procedures. So this is the last part. The first topic we'll cover in this video is accommodation. That is, what are the services provided to the patient when they are admitted in the hospital. Chiefly there are 4 types of accommodations you have to consider. First one is primary accommodation. Primary accommodation means the rooms where the patient should stay, a single room or multiple rooms. This is along with a nursing station and doctor's room. This is the primary accommodation. The second one is ancillary accommodation. What is the ancillary accommodation? Ancillary accommodation is where the support for treatment are provided, like portable X-ray, dietitian, mobile pharmacy, or pantry. These are the supportive ancillary accommodation. Number 3 is auxiliary accommodation. Auxiliary accommodation is not directly linked up to the patient, but indirectly they are linked up to the patient, like hospital pharmacy, hospital store, hospital record room, nurse's room, doctor's room. They are not directly related to the patient, but to serve a patient we need this type of services. And last is sanitary accommodation. This is the most important. That is the sanitization. That is the washrooms or bathrooms. If they are not properly cleaned, the patient may get superadded infections from that washrooms. So these 4 types of accommodations we have to consider to set up a ward. Now we must maintain some hygienic protocols. Hospital is a very safe place because we are always afraid of infections. So hygiene plays an important role when a patient is being admitted. What are the hygienic measures we are going to take? Number 1, temperature. Nowadays most of the non-government hospitals are centralized AC, air conditioned. So the temperature is automatically retained there in 18 to 20 degrees centigrade. That is the comfort zone. But in government hospitals, gradually we are seeing that the centralized air conditioning system is getting updated. So this temperature is important to give a comfort zone to the patient. Number 2, housekeeping or wiping. At least in infectious disease ward where an infectious patient is staying, you have to clean the ward at least 4 times a day, and in non-infectious cases you have to at least perform the cleaning process twice a day. Number 3, ventilation. It is very much important. Though the wards are air conditioned, it doesn't mean that there is no ventilation. You have to ventilate the rooms properly. That is, sometimes the air conditions are turned off and the windows will be opened. Fresh air will enter into the room, and then again the air conditioning system will start to soothe the patient. So these are some hygienic measures. This is the hygienic measures for the ward, the room in total. But the staffs like doctors, like sisters, like ward boys, they have to maintain their personal hygiene as well. Remember, each and every healthcare provider, the doctors, the nurses, the ward boy, they must wear apron. That is the doctor's coat. It is our identity, and it provides a soothe effect to the patient's psychology because it is white. Number 1. Number 2, you must have a tidy appearance. You must be neat and clean, properly groomed. Okay. Number 3, you must not have large nails or nail polishes or dark lipsticks in case of lady attendants, and in case of male attendants, he must not carry unshaved face like this. You must be well groomed because this will give confidence to the mind of the patient. And some general hygienes are: the hands must be washed off, they must be cleaned by proper sanitization or soap solution. Number 4, the sisters and the other attendants must be polite in practice, and also they must wear doctor's coat as well. and also the doctor, if the patient asks something, though it is not included in the hygiene portion, but I am mentioning here because it is also important, the doctor must answer politely, not aggressively, because the patient is already afraid of his disease. So it is the duty of the doctor to provide soothing effect to the patient. Now we are going to discuss a very important topic. You already have learned the word, that is the transfer. What is transfer? You have already known that one patient is transferred to another hospital, from one hospital to another hospital, or in different wards of a hospital. What is this? Actually, this is, first you have to know this transfer is strictly guided by law. You cannot transfer a patient arbitrarily. Say, just go to that ward, just go to X-ray room, just go to USG room. Not like that. There is a strict protocol. So first we discuss how many types of transfers are there. Number one, intra-hospital transfer. That means transfer within the wards of a hospital. Say a patient is admitted in a ward and the doctor feels that the patient should have a X-ray. So the patient is to be taken to the X-ray department, and to take him to the X-ray department there must be a written order by the healthcare provider to take him to the X-ray department. Without any type of written order, the patient cannot be shifted from one place to another place. Remember. Number two, inter-hospital transfer. Say from a private to a government, from a general to a multi-speciality. So if this type of transfer occurs, I am going to discuss later, there are some specific protocol and you have to maintain this. If you do not maintain, you can face the medical legal cases in future. And number three, from hospital to home transfer, that is the discharge, and there is also a strict medical legal guideline in case of discharge as well, which I am going to discuss. First, in case of intra-hospital transfer, I have already mentioned that you have to make a written order by the healthcare provider that the patient is being shifted from this ward to that ward due to this cause, and this type of ailments is with him, and this type of medications are provided to the patient. Until and unless this is done, the patient cannot be transferred from one ward to the other ward in a hospital. From hospital to hospital transfer, this is very common in day-to-day practice, because a patient has been admitted with chest pain and the doctor finds that the patient is having a heart attack or acute myocardial infarction, and the patient needs to a coronary support, that is intensive cardiac care unit, and suppose that hospital doesn't contain any ICC unit. So the patient has to be shifted to a hospital where intensive cardiac care unit present. So in this type of transfer, you have to write down a transfer, that is you have to write down a discharge certificate or transfer certificate to carry the patient to the next higher level or higher center, and the report will contain the cause of transfer, the case in hand, that is what type of suffering, the probable diagnosis of the patient, the medicines you have already given, the investigations you have already performed, and all the reports must be attached with your discharge, that is discharge certificate or transfer certificate. And in case of discharge, the number three, that is hospital to home transfer, I have already stated that it is a very much important from medical legal view. You cannot discharge a patient arbitrarily. If the physician has already advised, yes, you can now discharge the patient, then you have to maintain a few things. Number one, the discharge certificate. It must contain all the necessary data, the sufferings of the patient, how he was treated in the hospital, surgically or conservatively, the investigations done, the reports must be attached. If there is a history of operation, the details of the operation, and what process of operation has been adopted by the surgeon, and obviously the further medications and further investigations to be done with a review date. It is very important to ask the patient to review after something days that has already been directed by the doctor. Number 1. Number 2, the discharge certificate also contain patient's hygiene. He or she must not do this and this and this, or do this and this and this and this, and you have to arrange some support to transfer the patient or to discharge the patient from the hospital to the home. These are known as equipments. These are wheelchairs, these are medical records the patient needs, these are the special types of trolleys. You have to arrange this type of equipments. Okay, now after these 3 type of transfers, there are another 3 types of transfers present. Number 1, independent transfer. Independent transfer is when the patient can walk, can talk, can help you or can help himself to be transferred from one place to another place. That he can walk, he can run, he can go and to sit on the ambulance. So this type of transfers are independent transfers. Number 2, assisted transfer. What is assisted transfer? In assisted transfer, the patient can walk, can move, but he or she may need some support. Clear? And number 3, dependent transfer. In this case, the patient cannot move, he or she may be unconscious or may be conscious but have some severe physical disabilities, so that he or she cannot go or walk. So you have to arrange proper dependencies so he or she can be transferred to another place. So these are all about transfers. So we have already discussed almost all the aspects of a ward, its setup, its manpower, its protocols. So in our next video we are going to cover some new topics. Thank you very much.